Hello everyone, my name is Biagio Lucini and I am a professor of mathematics at Swansea University. Today I will tell you about pandemic modeling that we did for the COVID-19 pandemic here in Wales. The background to this presentation is that when the COVID pandemic hit back in March 2020, there was a need by local governments to somewhat predict and forecast the effect of the pandemic. Mathematical modeling coupled to supercomputing provides one of the best tools to check and to forecast scenarios that will give us the confidence to enact some intervention. So as I've already mentioned, this is some work that we have done under input of the Welsh government, and this is work that has informed the policies of the devolved Welsh government here in the United Kingdom. So let me start by mathematical modeling. So mathematical modeling is one of the best tools that we have to understand nature. And essentially, it moves from the observation from a phenomenon that we want to understand. And after the observation, then we abstract the properties that we believe are relevant, and we produce a set of equations that will enable us to make predictions. Generally, what we do is we compare the predictions that we make. This is a necessary step with the data. So if the predictions and the data that we have are in agreement, we can then build confidence that also what we can predict concerning to the future will be robust and can inform our reactions or our understanding. Of course, when we build a mathematical model, there are various phenomena that we need to keep into account. And there are various factors that can influence the evolution and the dynamics of the model itself. The ability of a modeler is to abstract those components that matter the most and to constantly refine the model with further details as they are needed. So this is the principle that we will use also in this case. Let me give now some background on how our pandemic modeling effort was born. As I said, the pandemic of COVID-19 with its consequences took everyone by surprise, and surprise actually doesn't make justice to what it happened. It was a serious shock, and there was the need to react rather quickly. Task forces were formed, and in Wales, the task force, well, the coordinating unit that was advising Welsh government was and still is the technical advisory cell. The technical advisory cell takes input at various levels, for instance, epidemiologists, other doctors, also statisticians, or behavioral scientists, in order to predict how the pandemic evolved and how people will react at the various stages of the pandemic and what the consequences will be for the future evolution of the pandemic itself. So in Wales, the technical advisory cell agreed earlier on that a mathematical model, a solid mathematical model for the pandemic was needed. So we were tasked with the task to put one together. And when I say we, I mean originally the people that you see in this picture, which is in addition to myself, is Professor Mike Gravenor, that I'm now indicating, who is an epidemiologist, and two research software engineers, Ed Bennett and Mark Dawson. So the importance of research software engineering was really high. And this is comparable, certainly at the same level as the mathematics itself and the epidemiology. The reason is that these equations that we were going to write, cannot be solved pen and paper in a traditional way. Very few relevant problems in mathematics today can. So mathematical modeling needs to be supplemented on one side by the specific discipline knowledge, which is provided by the epidemiological input, and on the other side needs to be supplemented by strong research software engineering skills that will produce a code that is performing. In the case of pandemic modeling, you certainly appreciate that the timeliness of the model and of the response is really crucial. So having a code that is performing on state-of-the-art architectures that fortunately were available to us was a key component of our response. So the infrastructure was provided by Supercomputing Wales, and Supercomputing Wales is the research facility for high-performance computing in Wales. Supercomputing Wales has supercomputing clusters that are made of Skylake processors tied together with InfiniBand interconnects on PowerEdge hardware provided by Dell, and at the same time provides the effort of research software engineers like Ed and Mark that were really enables at the beginning for us to be able to access this infrastructure. In particular, what we did is we adapted a model that was freely available, which is detailed in this publication, and we embedded it into the WESH context. So in this modeling, you can imagine that the population, the structure of the population in terms of ages, in terms of how people see each other are very important. I will discuss this a little later. But for the moment, the takeaway lesson is that multidisciplinarity is important in building the model, as it is high-performance computing on one side and strong research software engineering skills on the other. So we are really grateful to Supercomputing Wales and to Dell for providing them both. Now, let me talk about Supercomputing Wales a bit more in detail. So Supercomputing Wales is a national project which is supported by the European Regional Development Fund, which provides HPC hardware hubs. We have 2 of them. Originally, we had in the region of 12,000 cores of Intel Skylake divided in between the 2 hubs. And now we have increased that to around 17,000. Then there is a cohort of research software engineers, 15 across all of Wales on the project. And what they do is broadly to enable researchers to put their research, their computational research, on HPC hardware in a very efficient way. So the research software engineer takes apart the code and makes sure that it runs on the supercomputing system. There are obviously technical stuff that acts as the point of liaison between the user and the hardware itself and make sure that the facility works. The purpose of Supercomputing Wales is to encourage collaborations across disciplines and across universities in such a way that the researchers can dip further into fundings from research councils to sustain their ambitious research projects, as the research project concerning the COVID that I'm going to illustrate shortly, which in turn has big societal benefits. And this will result in new funding, as I've said, and in progress in our society, which in this case will translate in saving lives and improving the general conditions of living. Now, I want to go back to building the mathematical models. I will not be writing equations, but I want to give you an idea on how the mathematical models goes. So you can see a cartoon of a community where there are individuals that interact with each other. So there are individuals of various ages in various socioeconomic contexts, and they need to interact in their everyday life. For instance, in a family setting, or in a work setting, or in a school setting. Now, when there is an infection, some of those individuals, which I have depicted in red, will carry the virus and will be able to transmit the virus. If the individuals then are in contact with the others, they will also transmit the virus. So the ability of an infected individual to transmit the virus obviously grows with the number of contacts that they have. There are other colors in this diagram. So in blue, I have the people that are susceptible to the infection, the people that can get infected. And in green, I have the people that are called recovered or removed, those who cannot get infected anymore. So these are the people that somewhat have been either vaccinated and the vaccine is effective, or have gone through the infection and there is no waning immunity. So they have not lost memory of the infection itself. So what is important now then is that an infected individual will meet susceptible individual and will be able to transmit them the infection. So the more the susceptible people, and the more the ability of each individual that is infected to transmit the infection will grow. From the point of view of an individual who is susceptible, their probability of getting sick depends on how many infected individuals able to transmit the disease they will meet in their life. So this is why the contacts are very important. So they somewhat are the vehicle of the infection. So the more individuals, infective individuals, the susceptible individual itself will meet, the more is the probability that such an individual will get sick themselves and then will be able to transmit, to become a carrier of the disease and to transmit the disease. The dynamics of the infection is such that as people go through the various stages, they will eventually get the disease and will not be able to transmit the disease anymore. Most of them because recover, and unfortunately a few of them will die and will not be part of our society, regrettably. So with time, what will happen is that the disease will spread, and the individuals that that will not be susceptible anymore to disease will increase. For this reason, at some point, we expect disease to die down naturally and to become endemic. So the purpose of the modeling that we do is to reach that stage without too many consequences in terms of the sad loss of human life on the one hand, and at the same time as a secondary objective, if you wish, gets on with life as normally as possible. So for this reason, we needed to embed, as I was describing before, the structure of the population and of the contact of whales, since we target explicitly whales in our model, into the equation that we wrote. Now, if we think about the various aspects of our life, depending on our age, which is also an important characteristic, I will come back to that later. So what we have? Well, we have some of our life which takes part in a family setting, where we will experience certain contact depending on our age. Then if we are on a particular age, say, in an age in which you are expected to find a job, quite probably you have a job and you will meet your work colleague. We do recreational activities in which we meet another group of people. Kids that are still of school age or university age then will meet their peers in the classes. We go around to shops for our daily activities, And at the same time, we meet friends in some settings, such as bars or restaurants. This when life is normal, and as I said, each one of these contacts, in a way, could act as a vehicle for the virus to be transmitted. There is also another key aspect in the infection, which also affects the contact, is depending on the age, the probability of getting sick and eventually dying or recovering strongly depend on age itself, and it depends on pathologies. So in addition to the contact structure, we embedded age structure into our model. This is a typical run of our model, an example run. So what I will show in the top picture is the data with these red wavy forms. So the data are taken from the official statistics, and the data oscillate and are noisy for various reasons. One reason is that this is a phenomenon that is probabilistic, so it is impossible to have an exactly predictable number of infected per day, but one has an average plus fluctuations around that average, which is what you see from this data that go up and down. And then there is also a reporting issue, and there are some personal choices, like whether people want to be tested or not, or just decide to stay at home and isolate. The purpose of our model is in the various age group to somewhat project forward the dynamics of the infection to the equation that we have worked out, so that we are able to reproduce the data that are here. And we do that earlier on in the epidemic by assuming that the infection was imported. This is a standard methodology. So at some point in time, people infected came into Wales, and how many people infected came into Wales are the black dots that you will see here. So we did that to fix the peak in the first pandemic, in the first wave of the pandemic, and then we used that to predict what would happen in the second wave of the pandemic. The vertical lines are various intervention lines, because in order to stop the infection propagating, you need to break the links, and breaking the links means reducing the contacts. So how do we reduce the contacts? These are the non-pharmaceutical measures that have been in the press, and we have experienced it ourselves. We work from home, we don't go to the shops, schools are closed, and so on and so forth. So our job is to estimate what is the fraction of the infections that depends from each one of these settings, and at the same time could by removing or by mitigating the activity on that setting, we could keep the infection down. So here on the vertical line, here I've plotted the number of deaths, and you will see that on the vertical line there are particular triggers which will help us to enact or to decide when some measures will be enacted. Here you will see a thing that is peculiar of Wales, which is the fire break. At some point in October, November last year, we agreed that our infection rate was so high that we needed to curb it in some way. And this was a typical lockdown that was implemented just in Wales, and you will see the effect. And this will allow us basically to go into Christmas and New Year with a larger peak, but a peak that is not as large and as dramatic to overwhelm our health system as it would have otherwise been. These are the typical outputs that we get. So some outputs are scientific, and here there are publications that I've been involved with. One is methodological infrastructure, if you wish, and is based on the SAIL database, which is a database that contains the data for the medical data in a securely anonymized form for all the population in Wales. And essentially this work puts together an infrastructure and a protocol to analyze questions related to COVID during the pandemic. And this is the paper that I'm indicating now is a measure controlling paper, if you wish, that estimated the effect of track and trace in order to curb the disease in a context in which there is a gradient, so in which people obviously move forward between rural centers and urban centers. But the publications to which we give most of our attention are actually the publications of the Technical Advisory Group, which contain the scientific basis to inform the policy of the government. And this is an example one, there are several, and this is the fire break measure that I've described, the one that makes the case for the fire break measure that I have described in the previous slide. So there are many contributions and relevant contributions that we have done and we keep giving with the pandemic modeling. Here are a few. In July, we produced our first scenario, which is called the reasonable worst case scenario. This was July 2020, so July last year. In the reasonable worst case scenario, one asked the question on how bad things can get if the perfect storm arrives. So that's the purpose of the reasonable worst case scenario. So in that case, what happened was that we produced the scenario, and this helped planning for the National Health Service in the UK, for the ambulance service, and also for our track and trace system, so that the government could plan for how many tracers will need to be employed at various stages in the pandemic. I've described the fire breaks, and this was an analysis that went on in September, October 2021. These are the big effect in reduces the number of hospitalization and deaths in Wales. At some point in January, as the pandemic peak started to come down, we asked ourselves the question on how we can start reopening the society, and in particular, where it matters the more. So we started to plan for reopening of the schools, and we started to see the implications that had. And later on, we planned for a staged reopening of all the society. And in June, we see that actually this would have given rise to a third wave that unfortunately we are experiencing right now. So what we are doing now is we are studying possible measures to manage the third wave so that the health system is not overwhelmed, and at the same time, our society is as open as possible. The credits to our model is all over the place. The First Minister, Mark Drakeford, the First Minister of Wales, constantly in his press releases outline and the science that is at the basis of the decisions, of the policy decisions that they make. And quite often they cite the Swansea model, as it is now known, and the guidance, the robust guidance that they get from it. This is what we are doing at the moment. Of course, we are trying to answer future policy questions, as this is the first purpose of, and the key purpose of our activity. Then we are expanding the range of applicability of the model. We already have introduced, for instance, vaccination that was not there in the previous version. Now we are exploring what happens, for instance, with waning immunity and how a third dose could help to curb further the pandemic. We are trying to pay more attention to, now that we have understood the disease, to the health economics angle, but we want to expand the domain of modelization through other techniques that will help us to provide a broad view on pandemic modeling. And in particular, we want to use sophisticated visualization methods, machine learning methods, and more data analysis technique. We are expanding the team, and in fact, now in the team, we have about 10-15 academics that work on this modeling. But the most important aspect is that what we are doing is to help to fight the pandemic with modeling, which based on mathematics is one of the most solid and robust tools that we have, together of course with the epidemiological knowledge of the disease. And at the same time, save lives, improve the health prospects of potentially affected individuals. And this concludes my presentation, and I'd like to thank you for your attention.